Welcome to another enlightening episode of Healing Horizons, the podcast where we explore the cutting-edge intersections of science, spirituality, and healing. Today, we have an exciting discussion lined up focusing on how Ibogaine therapy is emerging as a promising treatment in breaking the cycle of methamphetamine addiction. I'm delighted to be joined by Will, an expert in Ibogaine therapy. Welcome to the show, Will. Thank you for joining us.
Thank you, Chris. I'm glad to be here and share insights into how Ibogaine therapy is playing a pivotal role in addressing methamphetamine addiction.
Great to have you here. Let's dive right in. Could you start us off by elaborating on the impact methamphetamine addiction has on both individuals and communities?
Absolutely, Chris. Methamphetamine addiction is incredibly pervasive and affects not only those who are directly addicted, but also ripples out to affect families, friends, and entire communities. Methamphetamine is a highly addictive stimulant that can cause both physical and psychological damage. For individuals, the cycle of addiction often leads to severe health issues, including heart problems, dental decay, and cognitive impairments. But the effects aren't just physical. Methamphetamine addiction is notorious for contributing to increases in mental health disorders, such as anxiety and depression. On a community level, methamphetamine addiction can burden public health systems, increase crime rates, and bring a host of social problems like homelessness and joblessness. These factors together create an environment that's incredibly challenging to break free from without targeted interventions, which is why exploring effective treatment options like Ibogaine is crucial.
That's a sobering overview indeed. Given these challenges, Ibogaine therapy is considered quite a novel approach. Can you provide us with an overview of what Ibogaine therapy entails and its origins?
Ibogaine is a naturally occurring psychoactive substance derived from the root bark of the Tabernanthe iboga plant, which has been used for centuries in West African spiritual ceremonies, particularly by the Bwiti religion in Gabon. In a medical context, Ibogaine is known for its ability to reset neural pathways that are disrupted in addiction. It works by affecting the brain's chemistry, which can help reduce withdrawal symptoms and cravings. This neural reset gives individuals a significant advantage in overcoming addiction, particularly to hard-to-overcome substances like methamphetamine. Modern Ibogaine therapy integrates these ancient practices with contemporary scientific understanding to offer a holistic healing model. While traditional treatments for addiction often involve a linear approach focusing on symptom management, Ibogaine offers a more integrative experience that addresses potential spiritual and emotional roots of addiction, providing a comprehensive path to recovery.
Fascinating. So, Ibogaine therapy combines both ancient and modern techniques to tackle addiction. Could you elaborate on the scientific research that supports the efficacy of Ibogaine in treating addiction?
Certainly, Chris. The research on Ibogaine, although still in its relatively early stages compared to traditional methods, is promising. Several animal studies and anecdotal human experiences suggest that Ibogaine impacts the brain's reward and addiction circuits. It influences neurotransmitters such as dopamine, effectively reducing cravings and withdrawal symptoms. There's evidence indicating that after an Ibogaine session, individuals often experience diminished cravings and a greater ability to abstain from substance use. Additionally, studies have shown a reduction in the activation of certain areas of the brain associated with addiction, indicating a potential for resetting the addiction pathway. However, it's important to note that while the initial results are promising, more comprehensive clinical trials are necessary to fully understand the long-term efficacy and safety of Ibogaine therapy.
It's promising to hear about these positive outcomes. Let's delve into some personal stories of recovery. How do individuals who have undergone Ibogaine therapy describe their experiences and transformations?
Personal testimonials from individuals who've undergone Ibogaine therapy often highlight profound experiences of self-discovery and healing. Many describe the therapy as a journey, one that includes confronting past traumas and gaining insights into their behaviors and addiction. There's a recurring theme of accessing deep emotional and spiritual understanding, which helps them reconnect with themselves and the world around them. One individual shared that Ibogaine therapy allowed them to see their addiction as a symptom rather than the core issue, helping them focus on healing underlying emotional wounds. Another common theme is the sense of renewal and empowerment. Participants often feel they've been given a second chance at life post-treatment. These narratives emphasize that Ibogaine doesn't just address the chemical addiction, but promotes holistic healing.
Those stories are truly inspiring and speak volumes about the therapy's potential. Can you discuss the emotional and spiritual dimensions involved in Ibogaine treatment? How do they complement the chemical effects?
The emotional and spiritual aspects of Ibogaine therapy are integral to its holistic approach. While the chemical effects set a foundation for recovery by interrupting addiction pathways, emotional and spiritual healing addresses the root causes of addiction. During the treatment, individuals report experiencing profound introspective trips where they confront past traumas and unresolved emotional conflicts. This process can release pent-up emotions and enable healing that might not be achievable through conventional therapies alone. The spiritual dimension often includes a sense of oneness or connection with something greater than oneself, which can bring a renewed sense of purpose and belonging. Many patients find this to be an invaluable component of their recovery, as it aids in reshaping their identities from being centered around addiction to being aligned with their newfound insights and values. This synergy between emotional, spiritual, and chemical healing is what makes Ibogaine therapy uniquely transformative.
It's incredible how these dimensions intertwine to facilitate healing. For those considering Ibogaine therapy, what is the process like, especially in Mexico? What should individuals expect?
Undergoing Ibogaine therapy, particularly in Mexico, involves a well-structured process that begins with a comprehensive medical and psychological evaluation to ensure the patient's readiness and suitability for treatment. After this initial screening, the therapy usually takes place in a supportive setting under the supervision of experienced healthcare professionals. The actual Ibogaine experience can last anywhere from 24 to 36 hours, during which participants are closely monitored for safety. The environment in Mexico provides not only the scenic and peaceful setting conducive to healing, but also allows access to experienced practitioners who are well-versed in the nuances of Ibogaine therapy. Following the session, there is usually a period of reflection and integration, where individuals work with counselors or therapists to process their experiences and develop strategies for maintaining their newfound clarity and sobriety in everyday life. Overall, patients should expect a deeply immersive, supportive, and transformative experience tailored to maximize the therapeutic benefits of Ibogaine.
It sounds like a comprehensive and supportive process. How does Ibogaine therapy compare with traditional addiction treatments? Are there distinct advantages or challenges?
Ibogaine therapy offers a distinct approach compared to traditional addiction treatments, which often focus on long-term medication and counseling. Unlike conventional methods, Ibogaine can catalyze rapid change by providing an acute interruption of the addiction cycle through a single or few sessions. This can be a significant advantage for individuals seeking quick relief from the burdens of addiction. However, Ibogaine is not a one-size-fits-all solution. It works best for individuals who are ready to undergo an intense and introspective therapeutic process. The therapy's challenges include potential risks and the need for careful medical supervision, especially since Ibogaine can interact with various medical conditions. It's crucial for patients to be informed and work with experienced professionals who can navigate these complexities safely. The combination of Ibogaine with other therapeutic interventions can offer a comprehensive treatment plan that encompasses both immediate and long-term recovery needs.
Balancing the immediate benefits and long-term planning definitely sounds crucial in addiction treatment. What are some of the potential risks or misconceptions surrounding Ibogaine therapy that listeners should be aware of?
One of the key misconceptions about Ibogaine therapy is that it's a miracle cure for addiction. While it can significantly aid in the recovery process, it is not a standalone solution. Continuous support, post-treatment therapy, and lifestyle changes are paramount for sustained recovery. Another common concern involves the potential risks, particularly the cardiovascular effects, as Ibogaine can lengthen the QT interval of the heart, leading to arrhythmias in some patients. These risks are why thorough medical screenings are necessary before treatment, and why therapy should only be conducted under experienced supervision. Misconceptions may stem from inadequate or misleading information, so it's vital for individuals to conduct extensive research and choose reputable treatment centers. Proper education on what Ibogaine can and cannot do is essential to align expectations with reality and optimize therapy outcomes.
That's an important point. Setting realistic expectations and understanding the full scope of the treatment can significantly influence success. With your expertise in this field, What insights can you share about the broader context of addiction recovery and alternative medicine?
The field of addiction recovery is evolving, with increased interest in alternative treatments that go beyond traditional methods. This shift acknowledges the complex interplay between mind, body, and spirit in the context of addiction. There's a growing recognition that conventional treatments don't always address the holistic needs of individuals, leading to an openness to therapies such as Ibogaine that offer integrative healing. Alternative medicine is increasingly seen as a complementary rather than competing practice to traditional methods, potentially enhancing overall treatment efficacy. The key is creating a personalized recovery plan that considers the unique circumstances and needs of the individual, incorporating a blend of medical, psychological, and sometimes spiritual interventions. This holistic approach can lead to more sustainable recovery outcomes by empowering individuals to take ownership of their healing journey and engage with it on a deeper level.
That's an insightful perspective. I'd like to close by asking for your advice to listeners who are considering Ibogaine therapy as part of their recovery journey. What should they keep in mind?
For those considering Ibogaine therapy, it's important to approach it with an open mind and a well-researched background. Ensure you're ready for the transformative and often intense experience it offers. It's crucial to choose a reputable treatment center with medical professionals who are experienced in administering Ibogaine. Be prepared for not only the therapy session itself, but also the critical integration period that follows. Think of Ibogaine as a powerful tool that, when used correctly, can facilitate significant breakthroughs in addiction recovery. However, continual support, whether through therapy, support groups, or community resources, is essential for maintaining the progress achieved. Remember, recovery is a journey, and having the right support systems in place can bolster the chances for long-term success.
Thank you, Will, for sharing your immense knowledge and experience on this topic. It's clear that Ibogaine therapy offers a unique and potentially transformative pathway for those struggling with addiction. That's all we have time for today on Healing Horizons. We hope this episode has offered you valuable insights into the potential of Ibogaine therapy to help break the cycle of methamphetamine addiction. Remember, recovery is possible, and there are diverse paths to healing. Until next time, stay informed and stay hopeful.